So today we are going to talk about
Part 2, what to expect when you go home, and also click the link below or subscribe to my channel to learn more about the 2-week rule for your babies. So without further ado,
the 2-week rule. And that's something that I've talked about in other videos, and so here it goes. It takes about 2 weeks for your breast milk to be established. So a lot of women are wanting instant gratification. You know, like I said, this is a 5-star restaurant. This is not McDonald's, and it takes a little time. And a lot of women just want to see if they have anything, and that's fine. You can hand pump or hand express, but don't use that pump. It's a machine, and that machine is not your baby. It will never act like your baby. So I recommend not to use a machine pump for at least 2 weeks. And then when you do decide, okay, I've got to have it, I've got a nodule, or I've got a mass, or I'm getting mastitis and I need to get it out, what you want to do is put it on the low setting, and you want to massage those knots and nodules and kind of push down, throw some hot washcloth on it and try to heat and massage, and kind of like do almost like a self-breast exam around and try to help with that. And when the machine is on, go on the lowest setting, like I said, and just do a few little quick ones and then a slow one. Mimic what the baby would do, and that will help get those out. If you get those big knots on there and they're not coming out, then you may have to be thumping really hard, putting some good heat on and trying to get it out. Because if they don't come out, then unfortunately we get that big bad word called mastitis, and that's something you would definitely have to go and talk to your doctor about. Most likely even get on antibiotics, but do not, under any circumstance, stop breastfeeding, because it's going to hurt way worse. And I'm talking from experience. I had mastitis with my son, and I delivered my baby naturally, and I felt that it was the worst pain I've ever felt in my life. So be careful of that. And one of the reasons why women get mastitis is from a machine pump. A machine pump before 2 weeks will cause an infection possibly, as well as it will start drying you up, and you will decrease your breast supply. So 2-week rule also pertains to you have excess swelling, and in about 2 weeks that's gonna slough off. You're not going to have to worry about dieting or anything like that. That'll eventually come off, especially if you're breastfeeding. That baby's going to be sucking you dry. So for about 2 weeks you're okay. And a lot of women go, hey Denise, I started drying up, my breast milk is not as is coming out as much, and I should start pumping. And I'm like, well, how much water have you drank? And I've always said this before, always you should be drinking at least 1 glass of water per breast. So in about 2 weeks, your swelling starts to decrease. You've been breastfeeding, you've been kind of moving around, you're feeling good, and all that extra volume has gone to that baby, which is great. But you need to stay hydrated. And in about 2 weeks, you'll notice that your breast will start drying up. So like I've always said, you do 1 breast, you should do 1 bottle or 1 glass of water. So that's about 8 bottles a day, and it shouldn't be like this is a big deal. You should be craving it, wanting that water. And that will keep you hydrated and keep your hair intact and your skin nice and moist. And once again, your pediatrician and your OB will tell you if you're still breastfeeding, you need to continue with your prenatal vitamins, and that will help as well. And in about 2 weeks as well, you could start throwing out your new foods when you're breastfeeding. I tell moms as a rule, write down your TT, poo-poos, and feedings and what you ate. And I would start with a good carb and protein diet for about first 2 weeks. And then, in 4 or 5 days, you're going to go, okay, well, let me try, an apple, or, a cucumber, or a glass of milk, and then a piece screaming in 6 to 8 hours after that. Guess what? You may not want to take it right now, or you write it in your little log. He doesn't like, peanut butter or ice cream or whatever you took, and just wait. So as a rule, I tell moms, it's a brand new baby with a brand new tummy. Give them about 2 weeks of good carbs and protein, a turkey sandwich, pancakes, pasta, a meat and potato kind of diet. And then throw in, okay, I'll eat an apple, or I'll eat, a peach, or I'm going to eat some broccoli, which I'd be careful on that. And one of the things I tell moms is don't eat a big old salad. And the reason why is because there's so many fruits and vegetables in a salad, and you do not know what's going to piss your baby off. So work your way into it. And honestly, in 2 weeks, you're pretty much eating whatever you want, and it's great. And you want to continue eating a good, healthy, balanced diet like you did prior to your delivery, but kind of watch what you eat for the first 2 weeks. And pediatricians now tell you to drink minimum to no milk. And when I say minimum to no milk, I'm talking soy milk, almond milk, lactose free, 1%, whole percent. I know our pediatricians in the South here will give vitamin D for your newborns because that milk tends to make them what they call colicky. And they are trying to minimize that, the stress on the baby's tummy as well. And another tip when on the C-section rule is when you are getting in and out of the bed or in and out of the toilet, get a high back chair, something like, you can push off of. If it's on front of the toilet, turn it sideways and put your toilet paper and all your peri products right there instead of you having to twist over it and you're going to go, ow, and you're going to feel that and it hurts. You may even feel like a pop or a sting. So if you put everything in front of you, then you can use it right there, and then you can take your hands and your legs and push up because you're not using your stomach because they just cut it. So use that chair. The same thing for the bed. Put it on the side of the bed as well. So when you're trying to get out of the bed, it can help hold you and lift up because when you go home, you don't have those side rails that we have at the hospital. So I would recommend trying to use a high back chair. Okay, so with that high back chair for those C-section moms, whenever you are sitting and standing, I want you to blow out. You know something's going to hurt you, blow out. It's kind of the same situation when, let's say, you are in a car wreck and the person that hits you is a drunk driver and they're completely relaxed and not hurt at all, and you're tense and hurting, and you're going to hurt for probably a couple days because you saw that wreck coming. It hurts. You get a shot, blow out. Don't tense up the muscles out there, just fixing to stick. Another little cute trick with your baby, actually when they're more like 2 or 3 years old and they're learning how to blow, bring bubbles to the pediatrician. When they are getting pricked or stung or shot, get some bubbles and let them blow out. They're going to focus on those bubbles or sweet treat and give them bubbles, and they will enjoy that a lot more than they will that one piece of candy. And then you took their mind off when they're going to get stuck. So my trick for moms that are hurting and they're getting in and out of the bed is to blow out. You're blowing out using less muscle and they're not tensing up so bad. And so you're blowing out. You're also giving your body good oxygen and good circulation, and you feel better. So blow out. It's a great little trick. So one of my final 2-week rule trick would be for about 2 weeks, I would breastfeed, if you're going to breastfeed, in a chair or a recliner in your whatever it's in your child's room that you put a rocking chair in, or the couch. And I would put everything you need there. I would put like their diapers and their wipes and your creams and your water and burp cloths and maybe your towel if you're going to, try to wrap it underneath your breast to lift the breast up. Have everything right there. And using a chair, you're able to look down. If you're in the bed, it's really hard to look, see if we've got a good latch. It's uncomfortable. You're having to move the bed. Oh, you got to get your bobby or your breast pillow, things like that. And you got to put them on, and you're just uncomfortable. And then your partner's in the bed with you, and they're like, "What's going on?" And they're trying to help you. One of you've got to get sleep during the night or day. So at night, this is another 2-week rule, you need to be up being a true night nurse, and that will help. So during the daytime, let them take care of the baby and just bring you the baby when it's time to eat. And then at night, you go in the living room or the baby's room, and you have all your stuff set up and you're ready to go, and your phone or your iPad or anything like that, and you sit there and you enjoy and visit with that baby. And once you breastfeed, within about 15-20 minutes, they're pee-peeing and pooping anyway. So you're there right there, change them, and then you both get to go lay down. So for about 2 weeks, I do recommend trying your best to breastfeed sitting in a high chair or recliner and not the bed. You will notice you will get a better latch that way, and then you'll also get some better burps, because remember about breastfeeding, the most important thing is the latch. The second thing is the burp. So those are my tips and tricks for vaginal and C-section for moms. Stay tuned, and we're going to talk about how these 2-week rules apply to your new baby boy or girl. So stay tuned. So guys, this is, I guess, the end of the 2-week rule. I hope this in some way helps y'all. I try to minimize as much as I could about the 2-week rule, moms, and the difference between moms and babies as a rule. Now, I always say 2 weeks, but it's really about 7 to 12 days. You know, some things will be shorter or longer, and I hope you guys were able to take this in and it made sense to you, and I hope it helps you in some way. If it helps one person, I'm great. If it helps 10, I'm ecstatic. I'm glad that you were with me this evening, and I hope you will continue to watch me. And if you have any questions or suggestions or things you would love for me to talk about, I would love to hear from you. And until then, good luck. You've got this, and I'll talk to you soon. Thanks, everybody, and y'all have a great evening.